Representative Garamendi, you know, you talk about the impact on, earlier you had talked about the impact on the 55-year-old or 54-year-old. If you look at a 54-year-old today, that individual is advised to save some $182,000 to $190,000 so as to apply for, you know, to have that available cash to cover the deficiency that's going to come with this end to Medicare, where you shop with this voucher and it's only going to cover 32 cents on the dollar. So that 54-year-old is already impacted. But there's more to the picture than that. When you draw the line in the sand and say, look, we end Medicare, and so those under 55 today will have to fend for themselves. They'll shop out in the private sector market. But when you don't have the newly entering senior community, as they turn 65 and enter into the mix, there's a correlation of age with drawdown of the healthcare system. And as you take the younger senior population, they provide for that ebb and flow within the pooling that Representative Courtney talked about earlier. The beauty of the program is that you pool seniors from the very youngest of senior to senior seniors. And as that need for health care grows with age, the newly entering help provide that balance. And so the ability, the stability of the program and the durability of that program is at risk, I believe, because we're changing the dynamics. And Representative Courtney, you have talked about the security of that program, of the stability that we can provide, and how we in this House, who as Democrats, have been working to strengthen the Medicare program, to build the trust fund so that there is this underpinning of support that will enable the program to continue and meet the needs of the oncoming population of baby boomers.
Right. Well, and thank you. And it's important because there was so much almost fear language surrounding this debate in terms of whether, Medicare is bankrupt, Medicare is going broke, Medicare is running out of money, that it's important for people to go back and read the trustees' report, which was just issued a few weeks ago. And it is a report that is issued on an annual basis. It has been since 1966, when Harry Truman was the first Medicare beneficiary to sign up for the program with his wife, Bess. And it has had its ups and downs over the years. The report that just came out said that Medicare is fully solvent, can pay all of its bills through 2024, and it can pay 90% of its bills through 2045. Now, there is no question that compared to last year's report, there was some deterioration in terms of that projection, but the trustees were careful to point out the fact that that slippage in terms of some of the years of lost solvency was due to the economy and due to payroll tax collection, had nothing to do with overuse or certainly nothing to do with the Affordable Care Act. In fact, they said the opposite, which was that the Affordable Care Act actually extended solvency of the Medicare program by a factor of 8 years. Thank God we had passed that legislation, because we really would almost be bumping up into a cliff at this point if we hadn't done it. But again, I think it's important for people to remember that going back in time, in 1970, the Medicare solvency report that came out for the trustees projected 2 years of solvency when it was going to hit that tipping point. When Ronald Reagan was president in 1983 and came to the Congress seeking an increase in the debt limit to avoid default, Medicare solvency was half of what it is today. So the fact is, it's had its challenges, but as you point out, there are good ideas about using bulk purchasing. There are good ideas about revisiting the subsidized insurance program in terms of the size of the insurance company subsidies. We can deal with that 10% shortfall between 2024 and 2045 without butchering the program. And that really is, in my opinion, the wolf in sheep's clothing surrounding this debate, that somehow people are using solvency reports as an excuse to basically eliminate the guaranteed benefit, which is just, again, this country, it is our duty as members of Congress to make sure that we protect for the next generation the benefit that our parents enjoyed and that pushed out solvency from age 70 in 1965 to age 78 today. That is a Medicare success, and we cannot go backwards as a nation.
Mr. Courtney, thank you for pointing out that very, very important fact that seemed to have been totally overlooked in today's debate, at least by our Republican colleagues. There's another factor here, and that is that Medicare, like all medical services across the United States, whether you are in Kaiser or Blue Cross, Anthem, or Medicare. All of these programs are carried along on the inflationary wave in healthcare, which actually runs 2 or 3 times the general inflation in our economy. So healthcare is growing very, very rapidly overall. It turns out that the inflation rate in Medicare is about 1/2 the inflation rate in the general healthcare system. Now, how could that be if Medicare is part of the healthcare system and takes care of the most expensive part of the population? How is it that Medicare is not inflating, the costs are not going up as fast as the costs are in the private sector, that is, the private health insurance sector? Well, the reason is, as I discussed before, Medicare is very efficient, a very, very efficient program. Universal benefit across the nation, uniform, clear deductibles, clear co-pays, and in Medicare Part B, cost sharing. All of that is there, and it's understood. Private insurance is 1,000 different policies, chaos, the marketplace. Now, in the Affordable Health Care Act, and we've talked about this a little bit, and we really need to have Americans understand that the Affordable Health Care Act had a whole series of very, very important legislative activities that will reduce the overall cost of health care. For example, electronic medical records, not written records by a doctor or a nurse, either legible or illegible, stacked in a great big stack of papers, and all of us have seen those, but electronic medical records, a very, very important way to reduce problems, reduce misunderstandings, back and forth with drugs and the like. And also, another very important factor is hospital infection rates. Hospitals that have a very high infection rate don't get paid for a second time when that person comes in for retreating the original illness, and has a very, very important impact on reducing the cost of medical services. Many other things you talked about, the drug benefit, and by the way, how is it that during the Bush period when the Medicare Part D, the drug benefit went into place, that the pharmaceutical industry was so powerful that they denied American taxpayers the opportunity for the government to negotiate for the price of drugs? Mr. Tonko, you raised that point. To this day, we've not had our Republican colleagues come along and say, oh yeah, there's a good way to save money, we'll just negotiate for the drugs. Turns out that the military and the services provided by the health care services provided by, they can negotiate for drugs, but not Medicare. So it cost us a few billion. You said $150 billion over 10 years. Is that the number you came up with?
I believe it's $157 billion, right? And you know, it's a benefit that ought to be shared on behalf of our nation's seniors. But you know, to the point earlier in this discussion,